cancer is the second leading cause of death worldwide. That's a fact that can seem overwhelming, but there's good news. Early detection can make a huge difference. The sooner cancer is caught and treated, the better your chances of beating it. That's why recognizing the early warning signs is so important. We've put together a list of 8 symptoms that you should never ignore. Being aware of these could quite literally save your life. Welcome to our channel, Lifeline Updates Health, your lifeline to all things health and wellness. Before we dive into the symptoms, let's briefly discuss what causes cancer. In the U.S., scientists have identified 4 top preventable causes: smoking, being overweight, drinking alcohol, and a lack of physical activity. Other factors that can increase your risk include a diet low in fruits and vegetables, or high in processed meats, and infections like HPV. What's shocking is that about 4 in 10 cancers are linked to these preventable factors. Of course, there are also things we can't control, like our age or genetics. Even with similar lifestyles, one person might get cancer and the other might not. This unpredictability is why staying alert to symptoms is so crucial. 1. Persistent pain. Pain is your body's way of telling you that something might be wrong. It could be the sharp sting of a cut or a dull ache in your back, but it usually has a clear cause. However, not all pain is easy to explain. If you're experiencing ongoing pain that doesn't go away, even though you haven't been doing anything strenuous, it's time to talk to your doctor. Sometimes cancer can cause pain by silently growing and pressing against bones, nerves, or organs. The pressure from the tumor creates a persistent ache that won't quit. In other cases, cancer cells release chemicals that make everything around them feel sore and sensitive, like your body's way of signaling something's off. 2. Unexplained weight loss. Weight changes are normal, especially with new diets, exercise routines, or different life stages. But if you start losing weight rapidly without trying, that's a sign something could be wrong. Losing 10 pounds or more without making any changes to your eating or activity level is a big red flag. Many cancers cause the body to burn more calories, even when you're not doing much. It's especially common in cancers like pancreatic, stomach, esophageal, and lung cancer. 3. Difficulty swallowing or a persistent cough. We've all had moments where swallowing feels difficult. Maybe a pill gets stuck, or food doesn't go down easily. Usually, it's no big deal. But if swallowing becomes a frequent problem, or you're dealing with indigestion, it could signal issues with your esophagus, potentially even cancer. Similarly, a nagging cough that won't go away could be an early sign of lung cancer. It might not seem like much, but if your cough lingers, or your voice becomes hoarse for weeks, don't ignore it. Tumors near the vocal cords can make your voice sound strained or raspy. 4. Unusual lumps. Finding a lump can be alarming, but it's important to stay calm. Not every lump is cancerous, but some are. Breast cancer, lymphoma, and other cancers can start with unusual lumps or swellings. If you discover a lump that wasn't there before, get it checked out. Diagnostic tests like mammograms or biopsies can help determine whether it's something serious. 5. Extreme fatigue. We all feel tired from time to time, especially after a long day or a busy week. But the fatigue linked to cancer is different. It's extreme tiredness that doesn't go away with rest. Cancer cells take up a lot of the body's nutrients to fuel their growth, leaving you feeling constantly drained. Even if you get plenty of sleep, this type of fatigue can persist and make daily life difficult. If you're feeling this way without a clear reason, it's worth seeing your doctor. 6. Changes in bathroom habits. Your bathroom habits can say a lot about your health. Changes in the color, smell, or frequency of your bowel movements or urine are usually temporary and harmless. However, significant or persistent changes could indicate something more serious, like colon, bladder, prostate, or cervical cancer. If you notice these kinds of changes, especially if they're ongoing, talk to your doctor. 7. Sores that won't heal. Most sores heal on their own, but if you have a sore that just won't go away, whether on your skin or inside your mouth, it's time to pay attention. This could be a sign of skin or oral cancer. For example, ulcers on the nipple might be an early sign of breast cancer, while sores inside the mouth could be linked to oral cancer. Regular checkups with your dentist can help catch these signs early. 8. Skin changes. Your skin can provide important clues about your health. It's constantly changing, so pay attention to anything new, like a mole or spot that looks different. These changes could be an early sign of skin cancer. If you're at higher risk for skin cancer, perhaps due to fair skin, red hair, numerous moles, or a history of sun exposure, it's a good idea to get a full-body skin cancer screening from a dermatologist every year. Remember, just because you have one of these symptoms doesn't automatically mean you have cancer. Many other health issues can cause similar symptoms. The key is not to panic, but to take action. Think of these symptoms as your body's way of letting you know it needs attention. Visit your doctor to get checked out. Early detection can make a world of difference. If you found this video helpful, give it a like and subscribe to our channel for more content like this. Thanks for watching and stay healthy.